Good morning, everybody. I'm Victor Davila. I'm the director of the Global Health Center at the Department of Medicine and the Institute of Public Health. This week, we celebrate the 10th annual Global Health Week at Washington University with the university-wide activities that are organized through the Global Health Center. The objective of Global Health Week is to foster engagement in global and regional health-related discussions, such as today's Department of Medicine Grand Rounds. Our Grand Round speaker is Dr. Juliet Iwelunmor, Professor of Medicine in the Division of Infectious Diseases and Associate Director for Global Health and Dissemination. Juliet obtained both her bachelor's degree and PhD in biobehavioral health at Penn State University. After that, she worked as a program specialist for the intersectoral platform on HIV at UNESCO in France. She was subsequently an assistant professor at the University of Illinois, Urbana-Champaign, and more recently, she was an associate professor at St. Louis University. Last year, she was recruited to Washington University School of Medicine as Professor of Medicine. Juliet is well known for her evidence-based intervention research program, which includes community engagement, particularly of young people, using participatory research and implementation research techniques and frameworks that are geared to improve health information dissemination in low and middle-income countries. Juliet is a prolific writer, and this has led to many successes in grant funding, where she is the lead principal investigator on at least 9 large NIH-funded research programs that total over $20 million in funding. She has also co-authored over 130 peer-reviewed manuscripts. In addition to her outstanding research career, she is a dedicated mentor to many early-stage investigators, both here at WashU and abroad. Her training and mentoring program in HIV and implementation science is also funded by several NIH training grants. On a personal note, I met Juliet around 2016 through her participation on the NHLBI-funded Pride Diversity Junior Faculty Development Program. She was at NYU back then, working with our good friend, Benga Ogedegbe. We have a similar program here at WashU, and we have graduated over 70 such trainees. More recently, we have collaborated through an NIH-funded program integrating hypertension and HIV care in Nigeria. Over these years, I have observed Juliet's meteoric rise into the academic stratosphere, and I am delighted that she has joined our WashU faculty. It is indeed a great pleasure to have Juliet Iwelunmor present at today's Medicine Grand Rounds during Global Health Week at WashU. The title of her talk is Hope and Hurdles with Sustaining Global Health Research. Welcome, Juliet.
Thank you. So it's an honor, and I'm just grateful to be here. So many people made today possible, and hopefully what you'll hear is the stories along the way. So this is the agenda. I'm going to talk a little bit about some background scars and what it's like to have a career in global health. Give a little bit about the context where I work in Nigeria, some hurdles and of course opportunities, and then some lessons learned from a lot of these ongoing projects. A lot of them are in the first year, which means we're still in the planning phase. RCTs that are to come, those data are not ready, but hopefully what you will hear is how we got here and hopefully where we're headed in the future, and so I'll close out with some of those directions. But just a little bit about a background. I belong to the field called implementation science. This idea of wanting to close the gap between what we know works versus what we're doing in practice. And when you hear a lot of the research or a lot of the training, the gap is almost presented as if there's a fine line, right, between research and practice. But in reality, at least in the settings where I work, the line is not easy. Research is often fragmented, but also practice in many cases are very, very fragmented. And so then the idea of, well, you now want to sustain a fragmented system. Well, at least for us, or the way we approach this work, you would need to see possibilities within that system. You would need to be able to open your eyes and your heart to look beyond just what you first see. You know, from the book Little Prince, one of the first books they tell you to read once you land in Paris. The idea of, you know, it might be a snake, but there are other things that the snake may have swallowed. And so to me, that is what sustainability is, you know, being open to those other things their eyes typically may not see. And so that story began from, you know, a fine line of women, the first being my grandma. The story, at least we were told, is that it took her 20 years, you know, after infertility. It took her 20 years to give birth to my mother. And when you hear, I mean, if you don't believe that story, you know, the only way to actually know that there was a depth to it is her middle name. Her middle name, literally once translated, means whoever thought Juliana would give birth to a child. I mean, it's literally, she named her whoever, I mean, her full name is Iwelunmor Juliana Gamunwa, which literally means whoever thought Juliana would give birth to a child. And so I stand here as that part of that legacy of whoever thought we would be here, right? And if not for her persistence, my mother won't be here. But then when you hear my own mother's story, she was married off as a child, right, at the age of 16, 17. And again, if she wasn't persistent and if she didn't even want to ensure she got herself educated, whoever thought that that legacy of me would also be here. So I really do stand, you know, from a group of women who actually seeded a plan of action. It didn't make any sense. It meant they were going to try, but all of that led to who and what I am today. And then the next big thing, and I'll talk a little bit about that journey, but the next big sort of highlight of my career so far is this project called iTest, right? Innovative tools to expand HIV self-testing, or what we know locally is for youth by youth. This idea of if you actually write a proposal with no intervention, yes, it may potentially be innovative, somehow NIH will fund it, and then somehow you're going to begin from the ground up with no intervention on a massive $6.4 million grant. It was a game changer because mostly, you know, there are very few people that would write proposals without an idea already. And so all we said back in 2017 is, I think we have an idea. We're gonna build it, and if you at least give us a chance, we will build it and make a difference. And we got the funded work. It ended last year. And I like to stop here sometimes because if not for this work, I wouldn't have been able to cultivate then what a plan looks like. Because what that work then meant was that as we kept on going and there was a pandemic and so many other things, at least you can see from this Brownson work on equity, and if you remember what was happening with the pandemic and everything, you know, this idea of moving away from deficit, of what communities are doing poorly, to actually think through what is good about a community. You know, how do you enhance capacity? How do you bring more people in? In other words, open the door so many more people can participate in research in ways the pandemic required us to do, and then maybe sustain that work. Because what's the purpose of, you know, going into a setting, doing good work, but somehow not lasting? At least those three things gave me a core value that then led to what we call plan, this idea of people learning, adapting, and nurturing core values, and I'll explain how we got here, can then begin to improve sustainment over time. And so then the last part of the SCAR is releasing that plan or remembering that plan. And so for Global Health Journey, like I say to people, really, what is your SCAR? I think all of us have a sense of how we got here, how we seeded our plan, how we cultivated that plan over time, how we're anchoring that plan, you know, things that are keeping us rooted, but ultimately, whether you're going to release it or remember it, you know, Unkalika is a thing Chinua Achebe would say, because the remembrance of the memory of it is the most vital, and then maybe hopefully sharing it to the world. And as you do that, maybe do that with joy, you know, live this life gently, because you're only here one time, and do that with hope, hopefully, knowing that the sky, you know, global health, as big as it is not your enemy, and hopefully destiny for your goals are your friend. And so a little bit of context. I work in Nigeria. I'm born and raised Grew up in Festac Town, Lagos, Nigeria. So I am a product of Nigeria. Did my formative years all the way up to secondary school in Nigeria. Grew up in Lagos, but also my schooling was in Edo State, now what's called Edo State. So I went to an all-girls school. I left home technically at the age of 10. I was in boarding school for 4 years. Before then, my family relocated to the US. So I spent a lot of time in Nigeria, at least in those days, just imbibing everything and what it means to be a Nigerian. And that is a very complex question. But we are a massive country in Africa, over 200 million people. But when you think of our health spending per capita, we only have about 74 million, which is like a travesty for such an amount of people. Poverty is rife, and it continues to be rife, where at least about 40% of Nigerians are really living on that $1.25 cents a day, and majority, in fact, almost all of them have no sense of what a health insurance. I mean, in my household, we were our energy person. In other words, we provided our own electricity because the government didn't have a system for that. We provided our own water because the government didn't have that. You definitely had to provide your own security because the government didn't have it. And so, Nigerian, then the idea of then tagging in a health insurance is like, far-fetched, because there's no sort of a system for that. And so that is the country, very complex, but a beautiful and lovable country with so many rich, diverse, culturalness to it, whether it be our jollof rice or our music or our clothes. Everything and anything about Nigerians is just as vibrant as you can imagine, despite everything else. When it comes to health, I guess I'm operating across 4 disease platforms now, and I'll tell a little bit about that. With the cervical cancer work that I do, the country contributes 10% of the burden globally. Right? Cervical cancer is the second most common cancer among women. And so by the end of today in Nigeria, at least about 22 women will die from something we could have prevented. You go to HBV, with liver cancer, it's a high-risk setting, it's endemic. About the prevalence is about 9.5. And then when you even go, squiggle it down to the fact that there's a Cairo Declaration that requires that every child should have access to birth dose vaccines, only 33% of Nigerian children are receiving that at the point of birth. Then you move over to NCDs, some of the work we're doing with HIV. About a quarter of Nigerian, kids have ever been tested. Most don't even know their status, and yet many more are acquiring HIV every day, about 17. You move to the world of NCDs, the same thing. Burden of hypertension is high. 1 in 3 deaths of Nigerian adults is actually stroke-related. And then when you even think of mortality rate, even if you get the stroke, within 30 days, about 33 will be dead. Within 2 years, almost all of them that had stroke are dead. And so you can begin to see that we do have a lot of work to do for so many things that can be prevented. And then the question then becomes, how do you seed that plan? How do you begin that process? My household was one where it wasn't uncommon to be dealing with malaria or diabetes. And so for us, it wasn't always a separation, because health was a thing for everyone. And so illness was always combined, and not, on one side there's HIV, on the other side there's NCDs. It was almost always the same and it's the same in many communities, right? Where you would hope that there are no vertical ways to approach health, but we're approaching it from a unified lens. And so for me, when I came back to academia after leaving UNESCO, or before I went to UNESCO, I was an NICHD pre-doc, where I sort of got that first itch of grant writing. I wrote it the first time, didn't get it, rewrote it, and finally got it. And I did spend some time, taking malaria rapid diagnostic test in those early days to Nigeria, and just using it in a setting, so I was probably one of the first to introduce it in this setting. And the research ended, but the mothers were wondering, why are they not having access to the RDTs at that time? Is the dissertation work, it has to end, and so I left. But then I left and went to UNESCO, and what many people do not know is when you think really about the foundation of even the field of implementation science, a lot of the things we are doing today, the UNESCO's intersectoral platform on HIV was already doing it. So I remember coming across documents or handbooks on even what implementation science should look like for the field of HIV, long time before there was a journal called implementation science. And so if the program started in 1988 with about 50 staff just really focused on addressing HIV and developed a lot of programs, reports on what the culture sector's response should be. As of 2013, I am the last employee because I was the one that actually closed out or phased out that division so that UNESCO then became an education-only sector response to HIV. And it was tough because, at least for me, I got to see the history. I got to see what it was like to really watch what the division did from the beginning all the way till the end of moving it then to an education sector response. And Jonathan Mann would say that, when you think about a lot of the things we're going through right now, all these threats we see with health is inevitable, but when your response is limited or haphazard, it's no surprise then that there's a pandemic or there's a lack of trust in a lot of the things we do because we're not doing it in a unified way. And I think I left UNESCO really at the heart of moving from MDGs to SDGs, and everybody and anybody was talking about sustainability during those last years of UNESCO. One of it being this very powerful paper that was also, by Thomas Bossard. 1990 was when it was written. It was really questioning, can you actually sustain work in settings limited with resources? And he would argue back as 1990, when we were doing the literature early in those days, that you need to have some sort of goals and objectives. Yes, there might be economic, political, institutional instabilities, but at least have some clearly defined goals. Be sure to integrate whatever you're doing into what's already existing. Definitely try to get some national funding or cost recovery. Negotiate the design of the project so that there's a mutual give and take, and definitely build capacity. And this was back in 1990. And so then when I returned, I had that in my head, and even though I returned and connected with people like Benga Gadebe, who was doing fabulous work with NCDs, in particular hypertension in Ghana, I came back to academia just having this sort of broad systems thinking. How do you bring more people into the field? I was squarely in the space of hypertension because of the work in Ghana, and so we wrote a K, and I was too early, so I had to redraw it because you had to have graduated 2 years with your PhD before you submitted. So, I learned my first big grant was to write and withdraw, and that experience of I did all this work, and okay, no problem. We'll try again the next year, and we did, and it was discussed but not funded. But 2015, was actually probably the most pivotal year because not only did I do things like Pride, but it was probably the first time I actually said, well, let's try it from a sustainability perspective. And let's try it not just from NCDs, the hypertension work I was beginning to do, but let me bring back my infectious disease work. Let me bring back my HIV work and see the whole system. And then begin to think of how can you use system science to sustain evidence wherever you may find it. A grant was not funded. It was discussed but not funded. But looking back, and I really didn't realize that journey until I was preparing for grant rounds, everything that I do today actually started from this work in 2015 without actually me knowing it, because the seed was planted in this grant that I never ever got, which to me was probably one of the best grants I ever wrote because it laid then a foundation. In other words, in preparing from this ground rounds, I was able to see sort of how that journey started from something I never even got, if that makes sense, right? And so then what does that mean? Coming back, you're reading, well, how do people plan for sustainability? The Shidiak and Motak paper back in 1988 would say, think about the activities, make sure there are benefits, do capacity building, and maybe all of those will be important indicators for how you plan to last. It led me into a systematic review of, well, what is that like in Africa, right? Have people thought about sustaining work, and if that's the case, what does that even look like? And so ultimately, we found some papers, about 41, many in Kenya and Nigeria, HIV being the one that a lot of people were thinking about with sustainability. Ownership, mobilization, especially at the community level, was crucial. But at the bare minimum, almost all of them says you got to have a plan if you're thinking about sustainability. And so I'm then being persistent. I didn't get the KO one, But then I became like obsessive with what is sustainability. I wrote an R1 on, well, let's go to marketplaces, because that is that is an institution that exists in many African settings, right? If you go to any, whether you're in Kenya or in Nigeria, if you go to any African setting, it is a viable entity that isn't going anywhere. And so, we thought about, well, could we go do, HIV prevention interventions in a place that we know will always be there. And maybe if we write it as a DP, the Director's Award, we may get it, because of course it makes sense to sustain work in a marketplace. Well, we didn't get that, but luckily along the ways, I focused on Benga's work and talked about maybe we sustain tax shifting strategies, and we got that as an R1. But I kept on going and, let's sustain other interventions. What about other interventions people have done? Can you take it to another settings, like the Jewel Project? Jewel Project was an evidence-based work that was done in Baltimore among drug-using women, right? The idea of giving them some sort of economic empowerment, similar to what Fresa Wamala is doing, gives women economic empowerment in the setting, and somehow you would reduce, drug-seeking behaviors and HIV. So I said, great. I got in contact with the people that developed it, and it made sense to want to take it, but then as you take it, maybe sustain it. Not funded. And then I talked about maybe develop a tool, right? What if we really mapped out what that would look like? And so in other words, my milestone was one where any and everything, and particularly because of an Enola Proctor paper back in 2015, any and everything at that moment was about sustainability. I didn't care where it was going to take me, but I wanted a science on that, and I wanted to sort of explore how you can take it in different facets. And I don't know why it's saying 17, but at this point it should have been, there was only one, So at this point of trying, there was only one I got, which was the small R03 on what it means to sustain at least tax shifting strategies. Until then, this iTest project came, iTest being innovative tools to expand. In other words, what happened with iTest was the ideas were there, they were seeded, but I wasn't calling it sustainability anymore. And Joe Tucker said, let's just call it innovative tools and see what that looks like. And so we then moved away from that word sustainability, because most reviewers called it ambitious. Like, what are you thinking? Nobody seemed to like that word sustainability. But they loved innovative tools, and so we went with that. And innovative tools is this study that I was saying earlier, where the first goal then was to crowdsource, go back to people and ask them, well, what kinds of ideas do you want for developing new HIV self-testing services? Then whatever we get, we said we were going to pilot it to make sense of it first before we then take it up to RCT phase. And so this is what it looked like. What I liked about that process was that we spent 2 years building then the intervention, right? Our hands were tied is one of the things we said, where when we started, there really was no intervention. If anything, we just opened up a challenge to many young people in Nigeria and said, give us your creative ideas on how we're going to increase the uptake of HIV self-testing. The top people moved then to a design-a-thon, similar to a hackathon, where they interacted with mentors and again, continued to give us their ideas, refine what they felt would be necessary. Then the top people, about 5 of them, moved over to a skills building process for about a month, what we call our boot camp, where again, they continued to refine and iterate what they felt. And so that whole co-creation process meant that we then piloted what came out of a year of just creating, and then we began the RCT by the 3rd year, and we were able to finish it last year, August. The RCT meant that we were able to recruit about 1,500 youth for a 2-year span, where we then not only recruited them with what was the final. So let me take it back. So in the 3rd aim, after you've piloted everything, you take up one final intervention and use that for the RCT. And so in that final intervention that included things like our box, the HIV self-testing box, included things like a participatory learning community, included things like so this was, I think he said, so this was the package. that was the package of what the intervention looked like. It included things like a photo verification app. All of that meant that we were able to increase testing rates from 6.72% at baseline to over 85%. And one of the beautiful thing about this project, we also retained the young people, about 80% over the 2 years. And so at least from this project, we were able to see that if you crowdsource it and build it, many young people will own it, and many young people will be willing to let you follow them for 2 years over time. And so then that meant as we were doing eye tests, a pandemic hit. A lot of us went back to the drawing board of like, what is our purpose? Why are we here? And so at least for me, I began to remember how I got here. Collins Arambua is my PhD mentor from Penn State. And if you know anything about Collins, he's always about, you got to learn to be comfortable with being uncomfortable. He would say things like failure is an option. He would say things like, do you know who you are without what you do, right? He would say things like, don't only focus on what's bad about a context, but what's good, what's positive, what's unique. Or almost all my Chinua Achebe quotes come from him. This idea of you should never enter your house, right, through another lens, through another man's gate. And so that was him, right? This idea of making sure you know who you are without what you do and be comfortable even when you feel uncomfortable. And so through him, we learned, I remember my doctoral work, he wrote this book, 1994, about health beyond the Western paradigm. And to me, this still remains probably one of the game-changing work for me as I do my work on global health. When people these days are talking about decolonizing and what that looks like, he had written about it since 1994 in terms of what that really can look like. And is that something even worth pursuing? Or, his book, 2007 book on really how we begin to heal our differences, right? All of us bring something to the table. Yes, the field may be fragmented, but how do we begin to heal those differences? He introduced us to Audre Lorde, right? How you use your anger for good, for example. Or even Toni Morrison, the fact that we should be rooted or anchored in some of the things we do. And so doctoral work for me wasn't just the science, but really the art of how you actually begin to do some of the things we do in public health. He created the Penn 3 cultural model. And the Penn 3, which was developed really for Africans back in 1990, would argue that you should look at what's positive, what's unique, before you actually focus on what's negative. And then with Joe Tucker, I came across crowdsourcing, right? This idea of organizing with the community what an intervention can look like, engage them over time to contribute, evaluate what comes out, and then maybe potentially share the solutions that come out over time. And as all of that was happening, though, death came into our household, where my sister-in-law in the middle, Angie, became one of those women who died from cervical cancer every day in Nigeria. And so I think the hurdle of why and how we could have prevented it then led to me connecting with so many people to develop then an extension of eye test, but this time access, this idea of how do we get more women to screen for HPV, to screen for cervical cancer. And the thing about Angie's story is that Angie was the only daughter. There are about 8 of them. She was the only daughter, 7 brothers. She talked every day to her mother, but when she was experiencing, her burden, when she was going through this process of really living with her illness, she never actually disclosed it until it was too late. Meanwhile, she talked to her mother every day. And so obviously for us, when we were thinking about what this Access project would look like, it wasn't enough at that time to only screen the mothers and while you ignored the daughters. And so Access, our NCI-funded project, talked about how you use mother-daughter conversations, right, to begin to seed ideas of vaccinating young girls, but also screening the mothers at the same time. And so then the pandemic also meant that, well, we're going to now release this idea of a plan. And so who am I? I am a mother, 4 children. The oldest is 12, the youngest is 4. Wife, daughter, sister, niece, auntie. I am a storyteller. I love what I do in this field. Professor, I am a children's book author. This idea of wanting to make sure young kids are seeding their plans early. I am a dreamer. I tend to use dreams, like I say, to change the world. And that's what Toni Morrison would actually say, that you ought to dream the world as it ought to be, not just how you want it to be. I am passionate about nurturing my family, young people, and then sustainable solutions to healing. I do do feel most at home in Lagos, but St. Louis is now home for me. And I like this quote from Bercy Head, because at least when you know who you are, you can tolerate strangers, because the things they would do would never really affect who and what you love. So that story meant that the pandemic also meant that as we were anchoring our plan, we were also thinking about how we give back, right? It's not enough, and I stand here as a McNair scholar, a Mertz scholar, a Pride scholar, knowing many people paved that way. And so one of the things we did was, during this period was create STAR, right? How do we get many young people interested in HIV research, stimulate their training, and then maybe experiences to HIV. We also did LIGHT, right? This idea of, if you think of the pandemic and we never involved a lot of people in public health, well, how do we crowdsource ideas from the public so that they too feel as though public health, or actually the public portion of health, is also for them. And so it led to 2 beautiful magazines that my team are doing in a reciprocity way, right? Where we're making sure we're giving back to the public that constantly nurtures what we call a career. And then all of that is still focused on this number, right? Whereas if you see many, funded work, the reality is that, even if you got that funding and you did the work for 5 years, by the time 2 years, that project is up, the odds of your project remaining is really almost zero. So most projects, about half, will not be sustained after 2 years of funding. And that's a travesty, right? When you think of where the source of that money is coming from, taxpayer-funded money. And so for me, sustainability then is about persistence, right? It's about how do you endure over time such that that work that was really heavily funded lasts beyond that initial funding period. And partly because of Marian Schreier and John Deering, they would say, it's great for the work to be effective, but if it's fleeting, of what use then was that work, right? And so plan is our attempt at trying to say, at least at the bare minimum, there should be people, there should be learning, there should be adaptations, because change is inevitable, but ultimately keep what matters. And so when I think of the work we have from Nigeria, a lot of them started last year. A lot of them came, so most of the funding started September last year. And I remember when I saw them, it didn't dawn on me that, you on one hand, the portfolio is infectious diseases, but on the other hand, the portfolio is also NCDs. And so for the first time, like I said, if 2015 was me seeding the idea of how do you bring the two together, for the first time, the portfolio actually had all of that without actually planning for that. And so then the only thing meant was that, well, we're gonna do it, right? We're gonna finally do what we wrote in 2015 without actually preparing for that. And so we held what we call the mega health event. This idea of how do you bring the public to a gathering in a fixed duration of time, but celebrate their creativity, celebrate their excellence. It does require long-term planning. It was an intensive planning process, but ultimately it will lead to an agenda, a cooperation among different actors, diverse ones, towards a common cause. There were 4 projects. We do have our Music for Health project, BP stroke. The idea of it is how do we use music to begin to prevent high blood pressure or increase stroke awareness. And like I said, if you know anything about Nigeria, we're very known for our music. And so it just makes sense to use music as a social determinant of health, but this time for blood pressure and stroke. We were going to continue our HIV project, but this time go back to community-based organizations and say, are there assets within you that we can begin to use to sustain HIV self-testing for at-risk adolescents or youth? We were going to continue our For Girls and Women project, but Nigeria also had a national rollout of HPV last year that despite now HPV being free, most girls still did not vaccinate. And so we were thinking, well, how do we continue to design programs to ensure that girls are actually going to be vaccinated? And then our For Mothers and Babies project, this idea of increasing them birth dose vaccination. So in other words, this is my 2015 KO1 grant that was never funded, but now finally in this way. really from seeding a plan 2015. And this is what then the study design looks like roughly. And I'm just here talking, I think, about the for girls and women study and the HBV. It always starts with an open challenge, and all of them had a website on their own requesting for the open challenge. So we didn't necessarily combine it as ones because we didn't want to confuse people. So there was a website just for the music one, a website just for the HIV one, and a website for HPV and HBV. But it starts with an open challenge. It moves to a design-a-thon, about 72 hours. It moves to a boot camp, and then it moves to the preparations for implementation. And so then the question then, well, what are you going to learn from such an event? When you think of all the people that came together to plan it, over 25 of us went through an intensive planning period that began January 24th and ended July 2021 with about 24 planning sessions across those months, held every Friday. When you think about the learnings that went on, each of those projects, whether it be music, had about 81 entries, to the For Girls one, which had about just imagine 365 different entries on how you increase uptake, or 365 different entries on how you increase birth dose vaccinations, or 123 different entries on how you sustain HIV self-testing. And then as we were going along, just even the idea of a mega health thing was not in any of those grants. And so obviously you can see, as of year one, we've already done an adaptation, right, of combining 4 different projects into one to begin to plan what that will look like. And then obviously making sure we're doing it with joy. It's an intensive process. It's stressful, but we want to make sure we're still fostering creativity and excellence of what it means like to do such a work in Nigeria, for example. And so it's still about persistence, it's still about hope, it's still about overcoming those hurdles, where the first lesson is that the people you're working will matter. You're going to need a core group of people, and hopefully you find good people that make this process joyful. But as you bring those people together, there will be tension. I remember when we first started, the very first program director we hired quit on us. And so it's like, okay, it happens, and so that's the reality of doing this kinds of work, that there will be even culture shocking, like, are you kidding me? You're going to bring 4 projects together? And so different people will have different ideas of, this is impossible, it would never work. But hopefully you have good people who see the hope in that work and are willing to come along with you for the journey. I think it was important for us to see for ourselves that when you give it back to communities, you're going to begin to cultivate ownership, because they owned the process. All we do was create a platform, but they own the process. I mean, they are pitching ideas. They are telling us, does this make sense? They actually own the process of co-creating an intervention. And that's the hope, right? Because we do want communities to be at the forefront of the interventions that we want to now create with them. But it's also resource intensive, it's time intensive. In a setting like Nigeria, where there's no Wi-Fi in many cases, or it's limited in many cases, that too can limit interactions. But at least the hope of wanting to seed or build something that is co-owned by a community is a hope, and something that at least helps us to continue in our journey towards sustainability. Change is crucial. If in our beginning, crowdsourcing events, we told people to just pitch your ideas and go from there, when we were changing this into a mega boot camp, we needed to make sure that everything was thoughtful and deliberate, and it could cut across those projects. And so we had people come up with a plan of action, for example, across. And you can see how people's plans varied across all those projects. We instituted things like actually a practice-based brief, right? So if it's common to have policy briefs, here we were asking people to actually give us a practice brief of what their user journey would look like if they were to implement whatever intervention they developed. We told them to come up with a persona, who are you actually building an intervention for and why? And then ultimately they pitched. None of this is on the grant. All of this are things that came out from that planning session with over 25 people of what would this look like, so that it cuts across for all the projects, and we can begin to have sort of a dent in the field of how or through which direction people build projects. And all of that is because real world is a messy place. The idea of doing 4 different projects in a setting where things are different is going to be uncontrollable and unpredictable. And so it was important that we were thoughtful and deliberate in how we made the adaptations for those projects overall. And then ultimately, we were nurturing deep connections. You know, oftentimes when people build interventions, especially when you think of people with disabilities, they are often the last on your radar. This process of opening the door and saying anyone can come in meant that we had participants that were blind. And so if our interventions or if our process never had inclusiveness in it, we had to, rearrange and reorganize ourselves to make sure that their, sense of touch, the other senses, sense of hearing, for example, were provided in a way that would allow them to fully participate, right? And so what ends up happening is if you're not nurturing those deep connections, there can then be unintentional exclusions, right? Which then drives away vulnerable groups that are supposed to be in projects. And none of this would have occurred without so many partners making it possible that we were inclusive and open to many other groups that typically won't be in interventions or intervention design. And so what does the future look like? In 1944, and when I was trying to anchor it back to where I am right now in St. Louis, in 1944, Dr. Manuel Smith had this address at the 50th anniversary of the National Medical Association. And when I was looking through it and reading through it, and in terms of even how they were conceived, the National Medical Association was an organization that was put together by African-American doctors, right, to actually have a space where African-American doctors can work together to address the health needs of African-American. And that word that I underlined there just stuck to me because, he would argue that if there's no vision, right, people perish. And so many pioneers, so many people, living or dead, struggled to make sure that African Americans had a space in the field. And this address was delivered here in St. Louis, Missouri at Sumner High School in 1944. And so you can imagine St. Louis being really a birthplace of really seeding a plan such that 125 years later, the National Medical Association remains sort of that vision of consciousness, right, of what quality and parity can look like for healthcare when you think of, how do we increase diversity in medical schools? How do we bring many more people together? Or how do we even promote the collective interest of African Americans? To me, it was important to see that some of those thinking, at least as an address, happened here in St. Louis. And so when I keep thinking of my connections or how I'm going to persist, if in 2015 we started that journey of trying to think through sustainability as an enterprise, as a marketplace, as an evidence-based intervention, or even as a tool, finally in 2023, I was able to put back that title on sustaining innovative tools. In other words, I was proud to have that title on an NIH-funded grant. And so here we are now actually doing what we tried to do a long time ago to really try to understand what is sustainability and how can you actually make sense of the activities, the benefits, the capacities of what that will look like in a setting typically underrepresented in research, but actually even the signs of what sustainability can look like over time. And I do that, just being grateful for being exposed to people like Chinua Achebe, who would say that then until the lions have their own historians, the history of the hunt will only glorify the hunter. We do need many more people passionate about sustainability as a science, as a thing on its own, because that's how we do realize the excellence with research. Otherwise, why bother with what is fleeting, with what is effective if it's always going to be fleeting? So I'm going to pause, Victor, and open this up now for questions. And just to throw it out to you as you think through the questions, hopefully for your journey, remember your scars.
Thank you so much, Juliet, for a phenomenal presentation. I'm going to open it now to questions. Anybody? Mark?
Thanks, Juliet. That was terrific. As you think about sustainability, can you talk about the different levels of stakeholders and political engagement that your team are doing, whether it's on the local or state or even national level?
I'm going to repeat the question if it's okay.
Yeah.
So the stakeholders and political commitment, how do
What's
you...
going on?
Yeah,
And well, we are working with the Nigerian Institute of Medical Research, probably the most crucial partner in all this. And Professor Ezechi was here with us last week. NIMA is the site where the first HIV case was identified, for example. It's a PEPFAR-supported site with over 25,000 patients that it follows over time. The fact that we are within the within the Ministries of Health Research Hub makes it easy for us to interact with a lot of policymakers. So for example, NIMA is holding its annual conference in about 2 weeks, and the Minister of State is going to be there to actually open. And so at least we have that connection, right, where a lot of the people we're working with within NIMA sit on the technical working committee of a lot of these issues across the country. And so they are seeing it, right? When you think of our design-a-thon events, most of the judges are policymakers. And so we cannot even begin to design the intervention without them seeing the possibilities that they themselves often don't see, right? When I think of the work we did over the summer, the director of the National Cancer Control Plan was a judge, and he kept on saying, you said there were 365 entries. We said yes. It's like, is there a way I can have all of that? Because I actually want to see the ones that didn't make it because there might be things missing. At least what we're seeing is that when we bring them, to be judges, to be participants, they get to see even for themselves the possibilities within their systems in ways they typically won't see if they only sat in their sort of ivory tower of an office. And so what our project is doing is at least bringing so many people in so that they can see that possibilities within the system. So policymakers are with us, as judges, are with us as technical partners. We just got a supplement, administrative supplement, that is actually going to now let us do crowdsourcing with policymakers alone. Crowdsourcing or design-a-thon with policymakers alone, just to see how we begin to even create what a vaccine-preventable cancer plan can look like for Nigeria.
Thank you so much for that. Vicky?
Juliet, thank you so much. It was a great talk. You talked about how large Nigeria is in the population and all the different regions. How do you address different cultures and backgrounds and communities within the different regions, rural versus urban, who might respond to the
differently
or have different approaches to the intervention?
So
Yeah, Can I repeat the question?
Sure.
Just, the question is really how do you deal with the different groups in Nigeria, which is a large country in terms of
Right.
diversity, and the rural versus urban.
Right.
And,
So the beauty of most of this project is about 2 years of it is planning, so that we get it right before we move to our RCT phase. And so what is also beautiful about crowdsourcing is that we open it up. Right? There's usually, so what I didn't share was that in those beginning phases, we build a website, and we also build a WhatsApp channel. We also build a social media channel to be able to reach as much people as we can. And we also develop like sort of in-person drop boxes where people can actually go drop their ideas stationed across the country. And so by beginning there so crowdsourcing is really like a contest. Think of it like, your American Got Talent kind of thing, where you actually open a contest up to the entire country and say, if you have an idea, send it, and maybe you may move over to the next phase of this process of designing. And so when we do it that way, you see that across those 365 entries come from all over the country, right? And so we are very intentional, even as we select, to make sure we're getting selections from the 6 geopolitical zones, so that not all the entries, for example, will come from Lagos, because if you did that, exactly as you said, you will miss out on what's good in the northern part of the country. And so we even arranged the finalists across the 6 geopolitical zones to ensure that there are representations across the countries. When it moves to the RCT phase, we're also mindful of that, and we make sure we're identifying sites across the 6 geopolitical zones. So in the ITEST project, I believe we're in 14 states, for example, and at three geopolitical zones. As we move to the sustainability, we're going to get them now through to the 6 geopolitical zones and maybe more states than the 14 we were. And so working with NIMA means we're very thoughtful and thinking always about the 6 geopolitical zones and not just the one zone. So Nigeria is made up of 6 geopolitical zones. There are about 250 languages. It's a diverse setting, but when you think of it from that perspective of making sure that, our data specialist is thinking of sites across these zones, you find out that you become much more representative of the diversity. Would it be perfect? No, but at least we're trying.
Gary?
Thank you for this talk. I love your energy, and it's very impressive.
Thank
and
you.
then you mentioned Jonathan Mann, who's a graduate of Washington University.
Here, I didn't do that. I did not know that. Thank you. Now I'm going to go obsessed. I didn't know that.
What I wanted to ask, and I mean it in a good way, but what I see a gray area between implementation and implementation research. So HPV vaccine and hepatitis B vaccine are good things, self-testing, but you didn't describe much to me that sounds like research where there's a hypothesis and we're going to test this versus this. Now maybe that's the argument.
It's there.
Can you repeat the question?
Sure.
We're differentiating between implementation
Right.
and implementation research.
Right. Fair enough. Do you want to?
Yeah, the question is, what is the difference between implementation research in your work?
Yeah, so again, this is year one of planning, and so I only talked mainly about really what that first year or two will look like. Almost everything has an hypothesis. I mean, as you know, with typical NIH grants, you have to say you're going to build the thing, and so our hypothesis is that when we crowdsource it, it's going to increase maybe uptake of the vaccine. And so we have, if I went back to the slide of at least the one that became say aim 2 right there, right? We're going to look, the outcomes are not there. So the ultimate outcome is increased adoption. So we're trying to get uptake to be high for self-testing. We're also trying to look at some of our secondary outcomes or sustainability. What does that look like? So you increase uptake, but then how does this project remain over time? We are not from a clinical perspective because we do know the vaccines work. That's not the issue for at least our setting. What we want to do is reach more girls. What we want to do is reach more mothers. So uptake, adoption of those vaccines are really our primary outcomes. And then our secondary outcomes are then whether it's sustainability or reach outcomes, if that helps. Think of it like the COVID vaccine. The vaccine worked, but many communities didn't pick it up, right? And so we're interested in adoption as a primary outcome. What does that look like when, a HPV vaccine is rolled out for free in a country, and yet many girls are not picking it up? What does it look like where the country says if you give birth in a clinical setting, every mother should be able to get HBV, hepatitis, birth dose vaccination for free, yet most mothers are not getting it. And so ultimately, by developing the interventions with the end users from the beginning, our assumption is that, our hypothesis that it would increase uptake over time.
Anuba?
Thank you, Juliet, for sharing your science and journey with us. I'm really struck by how the thread of sustainability really inspires your work. Could you share with us how you think about sustainability of your team's work, nurturing, mentoring, team, and other early investigators?
Right.
So the question is how do you think about sustainability
Right.
for the work that you're doing?
Right. I mean, I strongly believe that if there are only few people at the table, the field would never be expanded. And so every year on my own, I do a grant writing retreat just to get many more people writing. And so, my journey into grant writing, for example, was from the perspective of nurses at Penn State, actually. Janice, Morse, and Phil, they were very prolific nursing researchers who got R1 grants doing qualitative research. And I remember I took a class with one of them. And so that opened my eyes to really the possibilities of, you don't necessarily need quantitative, you could probably do qualitative and you get funded. And so that very first grant that I wrote was ethnographic study on malaria, and so I didn't get it the first time, but at least through them I saw that there were many ways you can write these grants, and then hopefully you will fund it. And so, they opened the door for me in ways I think I have not stopped, because they sort of hit that bug running. And so I approach it from, bring your perspective. It doesn't really matter. Just let's be persistent with this journey. And so I try to take that same spirit that I just shared here to the world of grant writing. I try to say grants can be like stories, can be like poetry. It does require you to be sticky with your words, sticky phrases. Make sure it connects. Ultimately, you want a reviewer to buy your good story. And so I think 2022 was the first grant writing retreat I did for my then doctoral student, Onyeka. And it really was just for her because she was getting ready to put her own F-31. And I thought if we just created a small space, maybe give her 2 champions, she may get through that process. It was for 2 hours, 5 weeks. And the first year, she immediately after it ended, she was able to submit her F-31 within her first year of doctoral work. She didn't get it funded. We revised and resubmitted the next year, and she got it funded with a perfect score. And so that next year of even getting her ready again, we expanded the grant writing retreat, got many people more involved, and again, she revised, resubmitted, and got a perfect F-31. And so then, I keep doing it, and I keep trying to get more people to see that there are many ways to at least try, and you will not get it the first time. I'm okay with saying, failure is an option, but at least try that process. And especially when you think of where we are in Missouri, it is our taxpayer money. Missouri as a state deserves this money too, and if there aren't that many people coming, when we think of the work we're doing with the Midwest DC FAR, if there are many more people writing these grants, well, it makes sense that California is going to be the highest state with many more funded grants, whereas Missouri is still at the 14th state. So there's work to be done in Missouri. There's work to be done globally. My job is to make people see the joy of this process. It's not perfect. You will fail. But at least let's try to get funds for many of the good works people are trying to do.
Very good. Well, I think that's the end of the hour today. So, Juliet, thank you so much on behalf of the Global Health Center, and appreciate you being here today. Thank you all for being here.
Thank you. Thank you.